Most people believe they would know if they were having a heart attack. They imagine collapse, severe chest pain,
My chest
an
feels so
obvious
tight.
emergency. But what if I told you some heart attacks happen quietly? No scream, no dramatic fall, no ambulance lights. And thousands of people only discover it months later, after permanent damage has already occurred. Before we go further, answer this in your mind. Would you recognize a heart attack if it didn't feel dramatic? Because by the end of this video, you may never ignore mild symptoms again. A silent heart attack is real. Medically, it's called a myocardial infarction, just like a typical heart attack. The difference? The symptoms are subtle. Blood flow to part of the heart muscle becomes reduced or blocked. Cells begin to lose oxygen. Damage begins. But the body doesn't react loudly. Some people continue their normal day. They go to work, cook dinner, watch TV, completely unaware their heart is being injured. And this changes everything. Because damage doesn't need drama. It only needs time. Now this is where it gets serious. When blood flow is restricted, heart tissue begins to weaken. If treatment is delayed, those cells die, and dead heart muscle is replaced with scar tissue. Scar tissue cannot pump blood. Over time, this increases the risk of heart failure, dangerous rhythm problems, future, more severe heart attacks. But here's what nobody talks about. Many people only discover they had a silent heart attack during a routine ECG. Imagine hearing your doctor say, 2. You've had a heart attack, and you didn't even know. If that possibility makes you uncomfortable, that's the point. Awareness changes outcomes. Let's break down what the body actually does. Pay close attention. And as you listen, ask yourself, have I felt this before? If yes, drop it in the comments. Not for attention, for awareness. 1. Unusual fatigue. Not normal tiredness, but deep exhaustion, the kind that feels heavier, harder to explain. Your heart, working inefficiently, forces the body to compensate. That compensation drains energy. Many people ignore this. 2. Mild chest pressure. Not stabbing pain. Not unbearable. Just pressure. Tightness. A squeezing sensation that comes and goes. Because it's tolerable, it gets dismissed. Have you ever felt chest pressure and brushed it off? Be honest with yourself. 3. Jaw, neck, or left arm discomfort. Heart pain can radiate. It doesn't always stay in the chest. It can travel to the jaw, the neck, the shoulder, the left arm, and because it feels disconnected from the heart, people assume it's muscular. This is one of the most missed signs. 4. Shortness of breath. Climbing stairs feels harder than usual. Walking across a room feels slightly heavier. You pause more often. You blame age, fitness, stress, but reduced oxygen delivery affects the entire body. 5. Cold sweats. Sudden sweating without heat, without exertion, without fever. The nervous system reacting to internal distress. 6. Nausea or indigestion, especially in women. Heart-related discomfort can mimic acid reflux. It feels digestive, not cardiac, which is exactly why it gets ignored. Pause for a second. Have any of these felt familiar? If even one sign stands out, this conversation matters. Silent heart attacks are more common in people with diabetes, women, older adults, those with high blood pressure, smokers, individuals with high cholesterol. Diabetes can dull pain signals, which means the alarm is quieter. But the damage is not smaller. And that's dangerous. Because the symptoms aren't dramatic. Because life is busy. Because no one wants to overreact. Because fear makes us rationalize. It's probably nothing. I'll wait. I'll see if it passes. But heart tissue doesn't pause for convenience. Time determines damage. If this information is helping you understand your body differently, this is what Human Health Files is built for. We focus on early warning signs before they become emergencies. Subscribe if you want to recognize danger early, not after it's too late. If you experience chest pressure, jaw or arm discomfort, unusual fatigue, shortness of breath, cold sweats, especially in combination, seek medical evaluation. Do not self-diagnose. Do not wait for drama. Early intervention can prevent irreversible damage. A silent heart attack doesn't look like the movies. It looks like normal life, with subtle interruptions. Your body rarely screams first. It whispers. Before you leave, tell me in the comments. Did any of these warning signs surprise you? Your answer might help someone else take their symptoms seriously. And watch this next video on early stroke warning signs. Because heart and brain emergencies are deeply connected. Don't miss the next signal.